Member for North Coast.
Thank you, Your Honourable Speaker, and thank you to the member for his comments. The member listed off some of the investments that the government has made in rural health or in recruiting physicians and nurses, but clearly the strategy for recruiting and retaining these specialists needs a revision, because we have a chronic shortage of physicians and rural healthcare practitioners in the north. He lists off the fact that I may be more informed now of some of the programs. I think the issue, Honourable Speaker, is not that we in the north or in the remote and rural parts of North Coast aren't informed of the program and the options, but what we need to see is a reevaluation of the program. And where policies aren't practical, they should be changed and made to work for the people in the North Coast. For example, the government, BC government here, pays 100% of ferry costs for a resident on Haida Gwaii to attend a medical appointment in Vancouver. So they will pay over $2,000 for two people, so an escort and a patient and a car, to take two ferries from Haida Gwaii to Prince Rupert Town to Vancouver Island, and onwards to Vancouver. They will pay for that, but yet a flight round trip from Haida Gwaii is less than $600, and only 30% of that is covered. How does that make sense financially, and how does that make sense for the patient, who would have to take 2 weeks or more off work or find childcare and or have all those incidental costs? It doesn't make sense. It's not a good policy, and it should be reevaluated. The ferry schedule is so impractical for medical appointments, as I just mentioned, that a constituent that couldn't get her car on the ferry had to take a taxi multiple times because she couldn't get her car on. So she had to take a taxi from the ferry to the hotel, another taxi from the hotel to the hospital, a taxi from the hospital back to the hotel, and from the hotel onto the ferry. So obviously transportation is a huge issue in the North Coast, in the remote and rural parts of British Columbia, and we're not looking at the cost to the healthcare system by not reevaluating the TAPS program. And so my request to the government is to reevaluate the travel assistance program to serve rural and remote British Columbia better. Thank you.